Direct Connection is made by MPT to serve all of our diverse communities and is made possible by the generous support of our members. Thank you. Live from Maryland Public Television, this is Direct Connection with Jeff Salkin.
Good evening. Welcome to your Direct Connection. Tonight we connect you with expert advice on how to get your lawn and garden ready for the coming winter. Yes, today was beautiful, but there is cold weather ahead. Joining us now from Valley View Farms is Carrie Engel. Carrie, nice to see you.
Hey, great to see you. I'm sorry you're not out here with us on this gorgeous night.
I would love to be there in person one of these years because I'm still not certain that the ridiculously gigantic pumpkin behind you is not made out of plastic.
It's real.
I want to see it in person.
I promise you.
And you're going to prove that,
Absolutely.
right? You're actually going to cut
Absolutely.
into the thing.
Yeah, a couple of our guys use a Sawzall and they'll cut into it on Saturday right around noon, and we count all the seeds in there. We've got a book over here with some guesses. In fact, your guys that are here tonight put in a couple guesses. We'll see how they do. And we have a nice prize of a $300 gift card for first prize and $200 for second and $100 for third. So it's kind of fun.
All right, let's get some overall lawn and garden tips from you. My big question is, when we get into late October, is it too late to plant anything? Say, you want to put a shrub, a tree, but there's going to be frost, before we know it.
Yeah, I think you're usually okay. Right now, the ground is still nice and warm. We finally got some rain, so we do have a little bit of moisture in there. 2 weeks ago, I wouldn't have tried it, but right now, I think you're in pretty good shape. But again, the ground's nice and warm, so things like perennials, trees and shrubs, if you get those plants in now and those roots have a chance to overwinter, by the time we get stressful summer and drought again next year, they ought to be set.
Well, how late is too late? When would you advise to just wait for spring?
I mean, if we got a couple of frosts now, I'd probably wait. I'd wait on some of the broadleaf evergreens if you're planting them out in an open area that might get a lot of wind, things like rhododendron and azaleas. But most of your deciduous plants and a lot of your perennials are going dormant anyway, so go for it. And I hope I can still plant grass seed because I just did it yesterday, so I'm hoping they come through.
Well, I was curious about that because you see people aerating. You talk about why that does more than just punch a bunch of holes in your lawn, and at the same time putting down grass seed.
Yeah, it's all about the roots and making sure those roots are in good shape. So again, the late rain we had this year has done good compared to all that dry we had before that. We had a nice wet spring, so our lawns are really green for a long time. So I would take the chance now and go ahead and reseed. Aerating is always good because again, that gets air down to the root zone and really gets things moving. And if you're going to only fertilize one time, fall's the time to do it.
I've heard that before, and part of the rationale I think involves the Chesapeake Bay and runoff. But from your standpoint, why does that make sense?
It really just, again, it gives a chance for those roots to really get established before they are active, before the grass blades and everything are actively growing and go into the stress that we do usually have here in late spring and summer around the Baltimore area.
Let me remind our viewers, if you have a question for Carrie, lawn and garden or potentially pumpkin related, give us a call. We'll have the number up on the screen. You can also email your questions. Our email address is livequestions@mpt.org. Now, Carrie, when we get the lawnmower out for the last couple of times, the trees are dropping leaves. You, I guess, would be in favor of mulching those instead of raking and bagging.
Absolutely. Going back to the health of the bay, it's just a great way to get a lot of nutrients back into the lawn by just chopping them up finely, letting them lay on the lawn. If you have a lot, go ahead and take them and move them into your perennial beds to get things over winter, or even use them as mulch around some of your trees. Or compost. Compost is also a great way to get your own, what we always call black gold, just absolutely beautiful soil for transplanting next year.
So if we're putting fertilizer on the grass and some of it gets in the shrubs, is that okay? Should we be fertilizing, garden beds, shrubs, flowers, whatever this time of year?
I wouldn't. I mean, you don't really want to this late. A lot of plants, I'm going to go back to those azaleas and broadleaf evergreens, they might put out too much fresh growth now, and then if we do get a freeze or a heavy frost, that'd kind of kill it back. So be careful of that. If a little bit gets on it, it's not going to be horrible. And we're not trying to grow our lawns this time of year that much, so our fertilizers aren't as high in in nitrogen, which is going to green everything up faster. So just take it easy on everything. I wouldn't worry about it too much. Absolutely make sure you're not using an herbicide in anything right now, especially if you're composting, putting stuff into your beds or any of that kind of stuff.
Let's take a phone call. Allegheny County, this is Lisa. Lisa, thanks for the call. Go ahead.
Hello, this is Lisa in Allegheny County. Thank you for taking my call.
You bet.
The local skunk has been aerating my yard for grubs, and I'm
okay.
And I'm trying to reach now. Is this the time to do it, or should I wait until the skunk is done eating?
It's easier to do them when they're still close to the surface. So for your Japanese beetle grubs, that's going to be right after they appear, or kind of right before they appear in May and June. But to be honest with you, there are different products that he can use. Some are going to be better to use this time of year. Others are going to be better to use in early spring. And there are some organic products like the milky spore that can be used pretty much any time, because that natural just kind of spreads out as needed to sort of get those grubs and gives you a long-term fix for these guys.
Call from Kent County. This is Ken. Ken, thank you for calling. Go ahead.
Hi. We live on a big farm, and I'm interested in putting in more things that the butterflies have in the middle of our farm. The butterflies like, in particular, milkweed. And we have these pods, and the furry things are on them. I'm wondering, I don't want them to blow away. I want them to put them right in my meadow. Can I poke holes and help them get in the ground this time of year, or is that going to be bad?
Ken, thanks.
No, I think that's a great way to do it. And, if you still have some left over in the spring, go ahead and watch their germination. But you're right, milkweed, especially for the monarchs, is kind of the plant of choice. We've seen a lot of butterflies this year, especially the swallowtails, and they love that solidago goldenrod this time of year. They love the Joe Pye weed that just finished blooming. They like a lot of the asters that are late, and it's kind of cool because that kind of gives them all food as they travel and migrate south.
We're getting all around the region tonight. Phone call from York County, Pennsylvania. This is George. George, thanks for the call. Go ahead.
Okay.
Your question, sir.
My question is, how far back should I trim my rose bushes that's over top of an arbor?
What kind of bushes? Are they deciduous or are they evergreen?
No, they're evergreen. They're roses.
They're roses. Okay, I'd wait until a little bit closer to Christmas time, the end of December, and take them back pretty far. Climbing roses you can probably take down to 2-3 feet and get a lot of those heavier canes out of there. For any of your hybrid tea roses you might have, you can honestly take them down, I'm going to say about shin high, and you'd be fine. And they're going to just grow up beautifully in the spring again on plenty of new growth.
Carrie, I'm seeing deer all over the place. Give me some thoughts
You're
on
not alone.
what you can put in. Yeah, I know their numbers are going to decrease shortly, but what can you plant that's deer safe?
I have a lot of problems in my own yard. So first of all, I spray. So I do use deer stopper. It's a nice herbal, smells decent. Some of that stuff is horrible. But they still manage to get through to my houses now and then. But I use osmanthus is a great one to keep deer away. For perennials, a nice early bloomer is hellebores, the Lenten rose, that's great. I've got the plum yew, I forget its real name, but it's a great plant that they don't seem to bother. And there's a fair amount of stuff, and we've had to sign all of our plants around here to let you know that we're going to say deer resistant. We stop at deer proof, because I thought spruce were deer proof, and nope, I was wrong.
Call from Baltimore County. This is Lenora. Thank you for the call. Go ahead.
Yes. I would like to ask the question is, what is the largest pumpkin in the world? And also, is the seed expensive? And then is the nutrition and the flavor is affected?
Great question. Lenora, you mean the seed to grow one of those crazy pumpkins?
This big guy that we have? Yeah.
Yeah.
Okay. All
So
right.
it all started.
Thanks for the call.
It all started with. Yeah, thank you. It all started with an Atlantic dill giant seed, and that's the one you can still buy in most garden centers. But then most of our growers, we send the seed back. So this guy grew a 2,035 pounder. Last year he grew a 1,750 pounder. We sent those seeds back to him, so I don't know if this is a child of that pumpkin or not. The largest one this year in the United States I know is over 2,300 pounds, and I think was in Rhode Island. As far as the world, I'm not sure. They seem to be better at getting this big in higher latitudes. So a lot of ours over the years have come from New England, upstate New York, even Canada. And I guess because they have longer days. And I just can't imagine, because most of these plants can't go in the ground up there until almost the 1st of June. And by the time they set fruit and all that, they've got to be growing 30, 40, 50 pounds a day to get to this side. It's just amazing. So they all have their tricks, and they don't always share about what they use on them.
And it's, downwind from the nuclear power station. That helps. All right, Carrie
I don't
Engel.
know. They seem to like, yep.
Valley View Farms, if you want to go guess the pumpkin seeds, head out there shortly. The thing's going to get cut up. We appreciate your time. Take care.
Thank you very much. Always great talking to you guys.
Likewise, we're back with our health segment right after this.
Can you tell us what you know?
Turning back now to the race for the White House.
The State Board of Elections voted Thursday to set up a new election.
It must be a very emotional day.
The world changed in the blink of an eye.
Children are at the heart of this story.
Drop your phone and just be in the moment.
You guys ready?
Yeah!
It's a thrill to see images of a new world for the first time.
I want to look back and say, I learned something. That is where transformation happens.
I see people cry on this show, and I'm like, what y'all doing, man?
Out of the water came this giant thing.
That's incredible.
I feel it in my bones.
It's so totally amazing.
They hear that song and they're like, that's my story.
I have chills.
All of the joys, all of the sorrows.
This is where it comes from. The rest is history.
Feel it in my bones.
In tonight's Your Health segment, we're joined by Dr. Suliat Noureddin, breast surgeon at the University of Maryland Upper Chesapeake Health and assistant professor of surgery at the University of Maryland School of Medicine. Doctor, thanks for being with us.
Thank you for having me.
You have an event coming up with the goal of preventing and getting early diagnosis of breast cancer. Tell us about it.
So this Saturday, the 26th of October, we're doing an event in conjunction with the National Coalition of 100 Black Women, the Anne Arundel chapter. The purpose of this event is to promote breast cancer screening as well as breast health and just informing women about their individual risk and ways that they can decrease their the risks associated with developing a breast cancer diagnosis.
And you operate on folks with breast cancer all the time. How important is it to catch it early?
Well, we really know that early detection really is key when it comes to surviving breast cancer. When we're able to catch it in the early stages, which is stage 1 or stage 2 disease, we're seeing patients living long, fruitful lives after a diagnosis. It's when they're presenting with later stages when we start to see difference when it comes to their rate of dying from a breast cancer.
Is the, I want to say compliance, adherence to standards for screening something you're happy with at the moment?
I think overall we do a pretty good job when it comes to screening for breast cancer. I think it's one of the few cancers where there's a lot of public, visibility when it comes to breast cancer. So I think the month of October is a big month for mammograms, so a lot of women are being advocates for themselves during that time. But I think it really is a cancer where we're doing pretty good when it comes to our screening. Our adherence rate in the U.S. is probably about 70%, which is much higher than other countries.
What would improve it even further? You hear complaints it's said not to be a very comfortable procedure. And people worry about getting bad news or getting a false positive of some kind.
There's a lot of anxiety that comes with breast cancer screening. So one, it's uncomfortable, and then two, just like you said, there is that anxiety of having an abnormal finding. But I will say that our mammography tools are actually greatly improved. We're doing a lot more 3D mammograms, which is tomosynthesis, and this is a way that we can actually get a better visualization of the breast tissue, and it decreases our chance of patients having to have to come back for another diagnostic mammogram. So with those changes, we are seeing a lot less anxiety when it comes to getting your mammogram every year.
What are the current screening recommendations for somebody at average risk?
So that's a bit of a touchy subject. Every organization has a different recommendation when it comes to screening. In general, my organization, which is the American Society of Breast Surgeons, we recommend starting your screening mammogram at age 40. Now, there are other organizations that recommend starting at age 45 or age 50. I tell women that it's just important that you know your risk and that you're going over that risk with a breast cancer specialist or a breast provider, just so that the time that you start your mammogram is in correlation to what your risk is, taking into account your family history and other breast cancer risk factors.
So what would accelerate the schedule for somebody who has some additional risk factors?
So things that may make us start your screening program a little bit early is if you have a very strong family history of breast cancer. And this is also including family members that present with breast cancer under the age of 50. So for those patients, we typically recommend that at least you start screening 10 years before that family member with the youngest diagnosis. But then also there are patients that may have exposure to radiation or patients that have other exposures that may increase their risk of developing a breast cancer. And for those, we have pretty strict criteria about when we would start screening for those patients and whether or not we want to add things like a screening MRI to their screening protocol.
Let me remind our viewers, if you have a question about the latest recommendations on breast cancer screening or treatment, you can give us a call. We'll have the number up on the screen, or email a question to livequestions@mpt.org. You were telling me that the outcomes for African American women diagnosed with breast cancer have historically been worse to some degree, and it's a little bit of a mystery. Well, maybe explain the situation first.
So right now we find that African American women tend to present with breast cancer, one, at a younger age. They also present with more advanced disease with their initial diagnosis. So that means the breast cancer may be large or it may show involvement in the lymph nodes. We don't know the exact reason for this. We think that it's multifactorial. It could be that it has to do with the access to care, but also that it may have something to do with the actual tumor biology. A lot of it is we don't have a lot of information when it comes to clinical trials because pretty historically, African American women weren't as represented on clinical trials. So there's a big push to try to increase that representation so that the recommendations that we are making are a little bit more diversified and making sure that we're dealing with an entire patient population.
Are you happy with the percentage of people getting screened within the African American community?
So we actually find that in general, the screening for breast cancer is pretty similar, whether you're dealing with African American patients or Caucasian patients. But what we're finding is there seems to be a delay between that screening and getting to other diagnostic testing, like a biopsy or a diagnostic mammogram. It's not clear why we're seeing that delay, but it does have an impact when it comes to patient survival.
Let's take a phone call from Baltimore County. This is Barbara. Barbara, thanks for the call. Go ahead.
Okay, I was reading where after age 75, a mammogram isn't necessary, and I'm wondering if that's true.
Thanks very much for the call.
So thanks for the call. Thanks for the question, Barbara. I will say that we have a whole lot of information about when to start doing mammograms, but not a whole lot of information about when we want to stop doing mammograms. I think a lot of it has to do with the individual patient and knowing their individual risk. There's 75 with a lot of other medical problems versus 75 that's still doing yoga every day. So all of that needs to be taken into account. And when we think about those other medical problems, if we feel that your life expectancy is shortened because of those medical problems, it's less likely that a breast cancer diagnosis is going to affect your mortality. So it is an individualized question that you have to have with your doctor so that you can make an informed decision for you.
How often do you have to do these? I mean, say it's somebody 50 years old, average risk, gets a clean report. You tell them to come back when?
So for me, I have my patients come back every year. There are some guidelines that patients at average risk may potentially be able to get mammograms every 2 years, but again, it just has to be a conversation. A lot of it is practice dependent in terms of what they're willing to do for screening, but I will say that it really depends on each patient.
Phone call from Baltimore County. This is Rutheno, I think. Did I get that right? Thank you for calling. Hello, are you there?
Yes.
Yes, what's your name, ma'am?
My name is Rathena Johnson.
Thank you for the call. What's your question?
I want to ask, this year, I used to get my mammograms here. I'm in Randallstown, Maryland. I used to get a mammogram every year and a D something. I don't have the papers in front of me. But in March or April of this year, I've had to get 4 stents put in my heart area, and my heart was raised up, and I'm wondering because of the machine, how they put your breast on, whether it's okay for me to get the mammogram, this year.
Thank you so much for the question. We should probably talk to a provider, but what advice and what other situations might cause a problem with the test?
So the fact that you've had stents in your heart placed before does not impact your ability to have a mammogram. It doesn't have your ability to have an MRI. So there shouldn't be a reason why they wouldn't be able to perform your mammogram as you previously have had done. I do think it just has to be a conversation with your other providers just so that you're clear on exactly what procedure they did and just to make sure that there's not any other reasons that you may not be able to undergo a mammogram. But I don't have anything that I can come up with from what you've told us.
You mentioned some advanced screening technology, whether it's 3D or MRI. Does that mean that somebody should, when offered a plain old mammogram, they should say, no, I want the souped up version?
Increasingly, more centers are offering 3D mammograms kind of at a baseline, and that's for your screening mammography. Now, when we start to add in other things like MRI or ultrasound, it's for specific reasons. So for patients that have over a 20% lifetime risk of breast cancer that's related to a strong family history, we do recommend the addition of MRI because in that specific patient population, we have seen a benefit to the addition to MRI in detecting a breast cancer. Now, with that said, the MRI is not a foolproof breast cancer test. I will say there is something called a very high false positive rate. And what that means is MRIs are really good at finding breast cancer, but they're also really good at finding a bunch of other things. So the risk with an MRI is that you may find things that require more procedures or more biopsies that you potentially wouldn't have had before. So for patients that are at that increased risk, we kind of cross that threshold in terms of the risk versus benefits.
Email question from a viewer: is DNA screening part of breast cancer screening?
So I'm assuming that the viewer is talking about genetic testing or testing of the DNA. So there's very strict criteria about who gets genetic testing in the setting of a breast cancer diagnosis. There's certain populations where we see an increased risk of genetic mutations in certain family groups, and there's certain questions that we would ask those patients that are coming in with a new breast cancer diagnosis. I will say that only 10% of breast cancers that we see are actually related to an inherited genetic mutation. So it's a really small select group of patients that are actually affected in that way. And with that said, our genetic testing doesn't catch everything. There's some clear familial patterns of breast cancer in certain families, and it may be that we just don't have that genetic information yet, and it may be something that we'll know more about in the future.
What's new in treatment, in the operating room, your world, radiation and drugs?
I think the general approach to breast cancer today is really de-escalation. We have come a long way from breast cancer, say 30, 40 years ago. We're finding that we can do a lot less procedures and get the same outcomes for patients. It started with doing mastectomies and removing all the lymph nodes under the arm as a standard procedure for all patients, and now we're able to sample less lymph nodes, and we're able to remove just part of the breast as opposed to having to remove all of the breast tissue. We're even able to decrease the amount of radiation that patients have to receive, depending specifically on the type of cancer they have and the size of that cancer. And then we're even changing the sequence in which we're giving therapy, where patients are getting chemotherapy before they have surgery. And doing that helps to decrease the size of their tumors, decrease the amount of surgery they need to have, and even potentially decrease the amount of lymph nodes that they would need to have removed.
And given all that, you're still better off finding it early.
Absolutely, absolutely.
So let's review the recommendations for a second. The breast surgeons say sooner, 40 or 50, you said?
40. And then there's other groups that recommend starting at age 45 or age 50. But it really depends on whether you're at average risk or at high risk. And again, it is a matter of meeting with your provider and figuring out what that risk is. And a lot of times that comes with calculating your lifetime risk through several risk calculators that we have available.
Just a few seconds for this. Some men get breast cancer, but there's no screening outline for that.
Unfortunately, we don't have a lot of information about screening for men in terms of a breast cancer diagnosis. And it is still a very rare diagnosis, but what we do find is that men that are diagnosed with breast cancer, we often will find a genetic mutation in those men. So it's really important that we catch, if we do find a man with a new diagnosis, that they are getting genetic testing, not only for them, but also to inform their families.
Dr. Sulia Noureddin, University of Maryland, thanks so much for your time. We appreciate it, and thank you for watching Direct Connection. Have a good night.
Your health segments are a co-production of Maryland Public Television and the University of Maryland Medical System.
This program was made by MPT to serve all of our diverse communities.